Have you ever noticed a tiny, subtle change on your skin, something that just doesn't quite look or feel right, but seems to stay flat and inconspicuous? Sometimes, the most challenging skin issues are those that hide in plain sight, slowly developing without clear warning signs. Morpheaform Basal Cell Carcinoma, or BCC, often exhibits a growth pattern that is sneaky and subtle. Unlike some more obvious skin cancers that may appear as shiny bumps or open sores, Morpheaform BCC typically grows as a flat, firm, scar-like patch on the skin. This makes it particularly challenging to identify early, as it blends in with the surrounding skin and lacks many of the classic BCC features. The reason for this deceptive growth lies in its unique cellular structure. Morpheaform BCC is characterized by thin strands of tumor cells that extend deeply and widely into the skin's dermis, often surrounded by a dense, fibrous, or scar-like tissue. These tumor cells invade the skin in an infiltrative manner, meaning they spread horizontally and vertically within the skin layers rather than forming a distinct, raised mass. This deep and aggressive growth pattern is what gives it its name, as morphea refers to a skin condition characterized by hardened, scar-like patches. Its deep penetration makes it more prone to recurrence if not completely removed. So what does this mean for you? If you notice any new skin lesion that looks like a scar without a prior injury, or a firm, waxy, or yellowish patch that doesn't heal, it's really important to have it checked by a dermatologist. They can use specialized techniques, such as dermoscopy, to get a closer look at the subtle features of the lesion. While the appearance can be tricky, knowing to look for these scar-like changes can prompt an earlier visit to the doctor. This type of BCC is sometimes referred to as infiltrative because of how its cells weave their way through the skin, rather than pushing out in a noticeable lump. This makes its borders indistinct and can sometimes lead to what is known as subclinical extension, meaning the cancer cells extend further than what is visible on the surface. That's why surgical removal often involves taking a wider margin or using techniques like Mohs surgery, which meticulously examines tissue layers during removal to ensure all cancer cells are gone. Understanding the subtle, scar-like growth pattern of Morpheaform BCC empowers you to be more vigilant about unusual skin changes. By recognizing these less obvious signs and promptly consulting a healthcare professional, you significantly increase the chances of early detection and successful treatment, protecting your skin health effectively.